I consider it an honor and a privilege to be able to introduce Heidi. She is an outstanding human being, as well as being a beautiful person, inside and out. The people who have had the lung transplants that you've heard here this afternoon, are attest to her talent, her kindness, her robust love that she puts into her job. And I love to tell the story about Marge Leary, who was shopping at TJ Maxx when she got her first call from Heidi, and Heidi says to her, "Hi Marge, what are you doing?" She said, "I'm shopping in TJ Maxx." And she said, "Well, are you having fun?" And she went on and on and on, and finally she said, "You need to get up to UVA right away, we've got some lungs for you." She does it very cleverly. Heidi and I first became acquainted up at UVA. They have a wonderful support group. It's a transplant support group. And it meets the fourth Thursday of every month. And again, it's a little different from this because we encompass all lung diseases, and that is really specific to transplants. So, but Heidi spends a lot of time making calls about lung transplants. So we're delighted to have her with us today. And you know, all of this thing that you've heard about recently about Mark Zuckerberg and Facebook and putting, Donate Life on his Facebook pages has yielded an extraordinary number of donors. And I wish I had the numbers. But they're growing by leaps and bounds every day. There's no better way than Facebook, I'm assuming, to double the numbers or triple the numbers. It's absolutely a phenomenon how they've come in on Facebook. And today's paper in Metro Business has an article about Donate Life, which used to be a division of UNOS, United Network for Organ Sharing. And they're not separated. The one grew out of the other. And so if you have the newspaper, please read the article. It's very good. And so I'll turn the mic over to Heidi. And you have her bio on the paper sheet, but she can tell you a little bit about herself, I guess, too. And thanks to Pookie, we have these wonderful T-shirts that say Breath Matters. He and his family donated these for those of us who did the walk and also for the group. It's a little large, but you can sleep in it. All right. Here's Heidi.
Oh gosh, it's really loud. Thank you so much for having me. I was originally scheduled to come a couple months ago, and then we had an audit, and so Russell was very nice to let me reschedule. And by the end of this, I'll probably be paying you to listen to it. So, well, I had to start. I won't be retiring for many years because I have my 3 daughters, Colleen, Shannon, and Megan. So I had to have that. Now I have to go back to my PowerPoint. My PowerPoint got encrypted from UVA, so I had to rebuild it quickly after taking my mom and dad out to dinner last night. So you're going to have to just bear with me here a little bit. So I've been at UVA for almost 24 years, and I started as a respiratory therapist. I was a respiratory therapist. There you go. I started as a respiratory therapist, and all right, I can't do 2 things at once. I mean, I can, but I just can't right now. And I was an echocardiographer. I ended up going back to nursing school at UVA. And actually, today is my 4-year anniversary of being a lung transplant coordinator. So I've taken care of patients before lung transplants were even a possibility. I've taken care of the first lung transplant at UVA as a respiratory therapist, and took care of first double transplant at the bedside. And now it's kind of all rolled around. So this is a little bit about evaluation, but it's not formal at all. I'm not very formal, and so please stop me if you have a question, or to stop me. And I just have to say, I feel like I almost cried about 4 or 5 times, because it's very, you get very connected to your, patient. They become friends, and this is your life, it's my life. And so, anyway, I appreciate everybody coming. And happy Mother's Day to everybody. All right, so here we go.
I have a quick question.
Oh, already?
Sharon mentioned Marge. Did she ever get her transplant?
She did. She got her transplant. She got called in a total of 3 times, and the first 2 were false alarm, or first 3 were false alarms, and then she, or is it 3 or 2? Was it 2 and the third one? Oh, because she came with another patient, actually. But she's doing well. I talked to her yesterday.
And she came home Friday.
Yep.
She's home. This past Friday.
Alrighty. So now, here we go. I'm going to show you a few of the reasons that it's my true honor, to do what I'm doing right now. And a lot of these are, of course, post-transplant patients. I don't have a lot of pictures in here. I only have some. But this is that possibility, that's that hope. And really, the number of people that get referred to our program, we have a small program at UVA. We do right now between near 20. In our big days, it was up to 30. We used to do coal miners, and we're not doing coal miners anymore. And our program got a little bit into trouble with our outcomes. And outcomes are the things that you need to be thinking about no matter what. It's like if you're going to buy a car, you do your research and you figure out what's a good fit for you, whatever program you go to. So part of this is going to be kind of a little bit impromptu, and I couldn't put a million slides. I could, but that would be hard. And so I'm just going to give you a little introduction to a very big topic. I am. Just a minute. So this is mostly when I'm first meeting a patient, I'm like, gosh, you got up this morning, you drove here, you don't know where the heck you are, you're at this big UVA, or it doesn't even matter where you go, you're carrying your oxygen, you can't breathe, you've been anxious about it, and then you're coming in to talk to somebody about having a lung transplant. That's significant. And so not everybody is a candidate. Probably about 15% of the people who walk through the doors end up being a candidate. This is a normal lung, explanted lung, and what we're looking at is people who have end-stage lung disease. End-stage lung disease for different kinds of indications, and some of this is graphic. Oh, is that a pointer? Is that a thing? Go this way. Okay, so this is end-stage obstructive disease, and I've heard just about every single indication for lung disease. And hopefully nobody will need a transplant, but if you do, these are some of the indications. Cystic fibrosis, restrictive lung diseases, and I'm not getting very scientific, but pulmonary fibrosis. There's a lot of you here that have COPD, emphysema, pulmonary fibrosis. Pulmonary fibrosis is really, there's a lot of research to be done on that. Primary pulmonary hypertension, sarcoidosis. Sarcoidosis, that just involves the lungs, are mostly what get transplanted in smaller programs. In larger programs, sarcoid affects a lot of organs. LAM and BO, and that's bronchiolitis obliterans, which is what people get when they've had a transplant and need to get retransplanted. How many people here have had a transplant? Raise your hand. I didn't know. Okay, okay. And then how many people here are waiting for a transplant? Waiting for a transplant. Okay. Is anybody being evaluated? Okay. So every center's got different guidelines. So we're a small center, Northern Virginia. They're comparable to us. Then there's the bigger centers. There's the super lung transplant centers like Duke, Cleveland Clinic, Pittsburgh. I think the center that did the most lung transplants last year was in California. So everybody's got a little bit of a different inclusion criteria to start a transplant. For UVA, you have to be before 65, age 65. However, that gets extended a little bit if you're in pretty good shape, exercising and don't have a lot of other heart disease. So we always tell the physicians to refer. You have to have insurance. This is a lifelong, this is the rest of your life. You're taking medications. Just like you take a breath, you gotta take your medications for the rest of your life. You have to have a committed social support. It's not this, oh yeah, I'll help you, I got lots of friends. It has to be very committed because that ultimately details what your outcome's gonna be. We can have people have $1 million, but if you don't have those people, if you have to worry about somebody going and getting your prescriptions or picking up some milk, that worries you. Body mass index.
We have a question over here.
Right, yeah. No, you can't hear me?
Yeah, I hear you fine. Why are you so close to me?
Let me see if I feel like I'm going to eat it.
Well, I think